After a diagnosis of tongue cancer, Lisa, a new mother, was faced with the loss of part of her tongue to save her life. She knew that she could lose the ability to talk and that her young son might never hear her voice again. But surgeons at the University of Michigan built her a new tongue.
Cancer wasn't even on the radar. I didn't know there was such a thing as tongue cancer. I was afraid of not being there for my son and not being able to see him grow up and do all the things you're supposed to do.
Oral cavity cancers are 25% of head and neck cancers, which are 1% of all cancers overall presenting in the United States. Cancer within the oral cavity is highly symptomatic. It can occur just about anywhere. There are places within the oral cavity that it occurs more commonly than other places. The tongue is one of the most common places that cancer does occur within the oral cavity. The most common cause of oral cancer is smoking and alcohol consumption. Particularly if you do both together, if you both smoke and consume alcohol, the chances are almost multiplicative. They're not simply additive. Tongue cancer is treated predominantly by surgery. University of Michigan has been a pioneer in treating head and neck cancer with chemo and radiation therapy. But unfortunately, we've been unable to come up with another treatment option other than surgery for the tongue. A very important part of creating a new tongue is looking where we're going to get the parts from. It's a little like going to the lumber yard. I've got to look at somebody's body and I've got to see where the appropriate type of tissue is located so that I can build a tongue. In most cases, it's somebody's forearm. It's a transplant of your own tissue. So rejection and the things that people are normally concerned with aren't an issue.
I feel like it's just my normal tongue. I try very hard not to take anything for granted because having it almost taken away, it makes you realize just how special every minute is.